The November deadline is looming, and South West care home owners say they're extremely concerned about an exodus of staff over the new laws requiring them to be fully vaccinated against COVID. People working in care homes who haven't yet had a jab have until tomorrow to get one in order to be double jabbed by the cut-off date. As John Danks reports, some in the care sectors say the legislation isn't fair.
By the 11th of November, everyone working at this Saltash care home must be double jabbed. But there is a small number of staff who are currently refusing the vaccine.
We're potentially losing very valuable, qualified staff, and they're losing their jobs.
Under the new regulations, care home owners won't be able to employ staff who aren't fully vaccinated.
They seem to have singled out the care industry for the requirement to have the double vaccination, but not included the NHS, which seems absolutely ridiculous.
At this Callington care home, the chef of 11 years who's chosen not to receive the COVID vaccine will have to leave.
These people have worked their guts out for a pandemic, and they still come to work with a smile on their face. And to be told that, this is now mandatory, it has to be done, I think is shocking.
Unvaccinated care workers have until tomorrow to get their first jab, so they have time to receive a second before the legislation starts in the autumn.
To be honest, I don't agree with what the government's doing at the moment, making people have these injections.
Devon-based Jo Clifford has worked in the care sector for 35 years. She was reluctant to get the vaccine, but has just had her second dose.
It's not fair to actually force somebody that's been in a job for years to actually leave that just because they don't want the injection.
Ramming it down through people's throats through legislation really hasn't helped at all. And it's caused a level of defiance across the sector, and people are leaving as a result.
The government says the vast majority of care staff are already vaccinated. It said it was focusing on encouraging even more staff to get jabbed to protect colleagues and those they care for. John Danks, BBC Spotlight.
Well, Nadra Ahmed is Executive Chair of the National Care Association. In your view, is this legislation fair?
No, I don't think it is fair, and I've said that from the outset. I think they've singled out care homes as almost a pilot, and it's discriminatory because what it's doing is it's moving our staff away from our roles into the health service, and we've lost many staff into the health service already because we absolutely accept vaccines are the way forward, but we cannot compel people to have them.
I know this has been a big topic of conversation on our BBC local radio stations today, and there's a real divide in how people think about this. I mean, surely if care workers don't have vaccinations, they're potentially putting residents at risk.
Well, what we know is that even if you are double vaccinated, all our residents are vaccinated, all our staff are vaccinated, we still know that the spread of the virus is there and people are able to pass it on and to get it. This is about trying to make sure that people understand the rationale. And if they don't want to have it, just remember that from March of last year to January of this year, this is the staff group that had to work without PPE, with an abysmal testing regime that came in, and they came in every single day and they looked after those vulnerable people.
I mean, there is going to be a huge problem here. Already there's difficulty getting hold of care workers. There are many vacancies. How many people do you think could be lost because they don't want to be vaccinated, and what sort of pressure will that put on homes?
Well, I think the estimate the government, when they finally did produce the impact assessment after the vote had been taken, was around 40,000. We think it's going to be higher. We believe that there's probably another 20,000 above that. We already have 115,000 vacancies in the sector. Unless there is a will within the department to concede that they have made an error, they will not review it.
And if they do review it and say that it will be legislation across all care, NHS, care homes, what would you say to that? Would that be better?
Well, Well, I think it would be much fairer because discriminating against care homes is absolutely appalling. And I've heard staff saying, well, if they're going to mandate us to do this now, what are they going to make us do next? We need time to build into this and make sure that we give everybody the time to understand it and actually access it.
Nadra, Ahmed, we appreciate your time. Thank you.